Typically, children would already be getting those vaccinations before going back to school, but of course the pandemic has changed a lot of things. Dr. Suzanne Wallace joins us now by FaceTime this morning to talk about this. Good morning, Dr. Wallace. Good to see you.
Good morning. Thank you for having me.
Well, we know that people still need to get their vaccinations, but what do parents need to know about the way things have been right now through COVID-19 for the past few months?
Yeah, so when the pandemic first started in March, and we first got those stay-at-home orders, people really prioritized coming to the doctor for sick visits, and checkups and well visits kind of went by the wayside. And what ended up being a byproduct of that was that we started seeing drops in vaccination rates, because we typically do those at kids' checkups. This is a trend that's been consistent across the country, but unfortunately now we're looking at a large group of kids that are delayed on their vaccinations. And as we're going into school, this is something that we need to address.
And so, I mean, it's like I need to make an appointment for my yearly checkup and haven't done it yet, just because of the things the way have been, and we've just been so busy and I keep forgetting about it. Right. And I would imagine for parents too, with everything being so different, it's not that they didn't want to get them vaccinated. They've probably kind of been busy doing different things too, right?
Exactly. And it's definitely a new time that we're facing, and everybody's kind of reassessing their priorities. And we just really need to emphasize how important vaccines are for kids, especially now. A really important thing to know about vaccines is that it takes a large percentage of the population to be vaccinated in order for them to truly be effective in preventing the disease. So viruses that we're preventing with vaccines, they need a host to survive. And in this case, we're the host. And whenever we see a dip in those vaccination rates, then that's a defect in our armor against them. And all of a sudden, they have a host to infect again. And so, that's why we've seen in certain areas of the country with lower vaccination rates, we've seen things like the measles outbreaks that have cropped up. And unfortunately, what that does is it leaves our most vulnerable patients at risk, such as our babies who are too young to get vaccinations, or other members of our community who have immune systems who are compromised for one reason or another. So it's very important.
So as we wrap up, just advice for parents if they do have concerns about getting their children vaccinated during the pandemic. Doctors' visits are so different right now.
They are, and I can assure you that most pediatric offices and doctors' offices in general are making keeping precautions to keep their patients safe. We're screening people when they come through the door. We're wearing masks. We're maintaining social distancing and doing everything that we can to keep you safe. And just like we're making sacrifices in our social lives and social distancing and wearing masks out, think of vaccines as another way to keep our communities safe, and something that we should prioritize right now.
All right, Dr. Suzanne Wallace, a doctor with the Simon Williamson Clinic Pediatrics, thank you for being with us. It's something everybody's got to deal with, and we appreciate you bringing us up today.
Yeah, thanks so much.